Hello, so this is a paper I wrote for my substance use class. It's not very long, but it's why people use drugs. Problem recognition among substance use disorder clients. So why people use drugs. Problem recognition among substance use disorder clients. Introduction. Some people with substance use disorders do not recognize themselves as having a problem because they do not fit the stereotype of an alcohol. Because they do not perceive themselves as having a substance use disorder, they are less likely to seek treatment. The factors that contribute to problem recognition among persons with an SUD is poorly understood. The Affordable Care Act has increased access to substance use treatment services throughout the United States. These improvements have not significantly increased the use of substance use treatment services. This information suggests that expanding access to services without addressing the barriers to services is insufficient. These barriers could include things like transportation and location, but could also include negative beliefs and attitudes. There is little research on SUD problem recognition. The research that is available suggests that problem severity, greater number of dependent symptoms, higher levels of depression, and experiencing adverse social consequences increases the likelihood that a person would recognize as having a substance use problem. Another important factor to consider is the stigma associated with having a substance use problem. Stigma consists of 4 interrelated components: labeling, stereotypes, separation, and discrimination. The stigma framework suggests differences between persons with and without substance use problems are distinguished and labeled. Negative stereotypes are then applied to label that person. This creates separation between labeled groups. Substance use problems are highly stigmatized and often regarded as a personal choice where the blame is to place on the individual. For this study, the authors recruited 54 participants with SUD to participate in a quantitative study aimed at examining barriers to treatment. People who participated in the study consisted of people over the age of 18 years old and met diagnostic criteria for a recent substance use disorder. The screener collected data on the socio-demographic characteristics, past 5-year alcohol and drug use histories, and lifetime and past 5 years substance abuse treatment utilization. After participants were found, interviews were conducted over the phone by a trained interviewer. Open-ended questions focused on alcohol and drug use behaviors, past treatment experience, and barriers for not using treatment. Participants received a $40 Amazon gift card for their participation. In analysis, themes were discussed and a code book was developed. The process was completed until key themes were established and the code book was finalized. The authors focused on 2 open-ended questions. Have you ever considered cutting down on your alcohol or drug use? And how would you define an alcohol or drug program? These questions were asked to individuals who stated that they did not have a problem or needed treatment. Many participants explained not having a substance use problem because they were functional. Participants defined being functional as being able to meet important social and life responsibilities, such as attending a family or work obligation. This was used to justify not having a problem. Self-stigma was also pervasive among participants and closely related to problem recognition. Many participants used negative stereotypes to describe people with alcohol and drug problems, such as being losers, homeless, terrible people, drug addicts, and people who have lost their jobs and families. Participants differentiated themselves from, quote-unquote, those people. So, conclusion. This study aligned with past studies that have found that high-functioning individuals may be less likely to recognize having a problem. The authors found that being able to engage in substance use without experience any adverse consequences and self-stigma were closely linked to problem recognition. These findings can be used to increase problem recognition and utilization of treatment services among those struggling with substance use problems. The findings in this article are concerning because it suggests that a segment of people with SUD may delay treatment until it is too late or avoid it altogether. Expanding treatment services beyond healthcare settings may be key in researching those with SUD who do not perceive to have a problem and could potentially increase problem recognition among this population. Encouraging those in treatment to be less anonymous and to share their recovery stories may have an important effect on how people with SUD are perceived and help combat stigma. This article will help me as a professional because I will be able to help people who may not realize they have a problem with alcohol or other drugs. And that is it. Thanks for watching.